ABC 10's Alicia Machado is here now, and keep in mind, so many things can impact the mental health of young adults.
That's right. And Alicia, you talked with experts about how these burdens have gotten worse over the past few years. What are some ways that friends and families can help?
Well, Laura, there are so many ways, and it all just starts with sparking that conversation with your loved ones. Mental health experts say that young people are dealing with a slew of challenges these days, from the impacts of the pandemic and isolation to social media, as well as depression. But they say that taking that first step to talk with a loved one can make a real difference. Take a look.
These are certainly trying times for everyone. It's important to talk about what's eating you up and what's really occupying your mind. It doesn't hurt to talk.
Advocates encouraging conversation and increased awareness about mental health. Young people facing a number of challenges, from social media to the pandemic, which can be tough on mental health.
We think COVID was so far back, but it's actually still pretty recent. When we think about our teens and our young children, these are folks that are just coming back into the school, back onto school grounds, a little less than a year ago. There's a lot of pressure that's on them in the school setting now about getting caught up and getting things back on speed.
In 2020, suicide was the second leading cause of death for people ages 10 to 14 and 25 to 34, according to the CDC. In our region, the Olivehurst community processing the tragic loss of a 14-year-old student at Lyndhurst High who died by suicide, according to the Yuba County Sheriff's Office. The school canceling classes for the rest of the week and offering resources, including grief counselors and psychologists.
We're seeing, rates of mental health, rates of substance use disorder, all of that in our children and teenage populations increase right now. And so what I can say to folks is you're not alone.
Psychologists and wellness professionals are in high demand. Doug Smith with NAMI Sacramento says friends and family can help by starting the conversation.
Letting them know that you're concerned. And I've noticed you're down a little bit these last few days. Are you okay? And create that space to have that dialogue.
The Sacramento Foundation for Suicide Prevention says there are some warning signs you can look out for.
We talk about it in 3 different ways: talk, behavior, and mood.
Next, talk to them, listen, and get help from a wellness professional like a psychologist or school counselor.
And Alicia, talk about some other options that are available to people who may be having a difficult time.
Yeah, well, there's a whole slew of national and local resources that people can turn to. There are free and over-the-phone options. We're going to have some of them up for you on the screen in just a second. So if you're interested, this would be a good time to take out your phone and snap a screenshot for someone who may be in need. 988 is now the National Suicide and Crisis Hotline. There's also NAMI, the National Alliance on Mental Illness. They operate all over the country as well. And lastly, there's the Sacramento County Department of Health Services. You can see the numbers up on your screen there.
Very important resources and an important story. Our Alicia Machado live in studio for us tonight. Thank you.